Overview: your abdominal muscles are strong bands of muscles lining the walls of your abdomen, trunk of your body. What are abdominal muscles? Your abdominal muscles are strong bands of muscles lining the walls of your abdomen, trunk of your body. They're located toward the front of your body, between your ribs and your pelvis. Your abdominal muscles have many important roles, including supporting your trunk, helping with movement and holding your organs in place. The 5 main muscles in your abdomen are rectus abdominis, pyramidalis, external obliques, internal obliques, transversus abdominis. Together with your back muscles, your abdominal muscles make up your core muscles. They help protect your spine and keep your body stable and balanced. Find a primary care provider. Schedule an appointment. Function. What are the functions of your abdominal muscles? Your abdominal muscles have several important jobs. Stabilize your trunk and maintain consistent internal pressure in your abdomen. When you need an increase in pressure, like in essential bodily functions like breathing, pooping, coughing, vomiting and childbirth, these muscles regulate that pressure. Help with movement of your body between your ribcage and your pelvis, allowing your trunk to be in constant motion. This helps support your spine and trunk during walking, sitting down, standing up or twisting from side to side. Hold your internal organs in place and protect them. This includes your stomach, intestines, pancreas, liver, gallbladder and other organs. Maintain your posture and provide core support. Anatomy. Where are your abdominal muscles located? Your abdominal muscles are located between your ribcage and your pelvis on the front of your body. How many abdominal muscles are there? Your abdominal muscle anatomy consists of 5 pairs of muscles. 2 are vertical, up and down, muscles located toward the middle of your body. 3 are flat muscles stacked on top of each other, situated toward the sides of your trunk. The 2 vertical muscles are rectus abdominis. This pair of muscles goes down either side of the middle of your abdomen from your ribs to the front of your pelvis. They're divided into 2 segments by a muscle called the linea alba. Your rectus abdominis hold your internal organs in place and keep your body stable during movement. The rectus abdominis may form bumps, sometimes called a six-pack, when someone has a trim, fit abdomen, abs. Pyramidalis. This vertical muscle is small and shaped like a triangle. It's located at the base of your pubic bone. It sits in front of your rectus abdominis and attaches to your linea alba. Your pyramidalis help maintain internal pressure in your abdomen. About 20% of people don't have pyramidalis muscles. The 3 flat muscles are external obliques. Your external obliques are a pair of muscles, one on each side of your rectus abdominis. They're the largest of the flat muscles and sit at the bottom of the stack. They run from the sides of your body toward the middle. Your external obliques allow your trunk to twist from side to side. Internal obliques. Your internal obliques are a pair of muscles on top of your external obliques, just inside your hip bones. They're much thinner and smaller than your external obliques. Like your external obliques, they're on the sides of your rectus abdominis, running from the sides of your trunk toward the middle. They work with your external oblique muscles to allow your trunk to twist and turn. Transversus abdominis. Your transversus abdominis are the deepest of the flat muscles, layered on top of your internal obliques. These muscles help stabilize your trunk and maintain internal abdominal pressure. Conditions and disorders. What conditions can affect the abdominal muscles? Several conditions can affect your abdominal wall muscles. Abdominal strains. The most common condition affecting the abdominal muscles is abdominal strains. Also called a pulled abdominal muscle, these occur with overstretching of your muscles, overuse of your abs, quick, violent twisting of your trunk. Strains can involve anything from tiny, minor tears in your muscle fibers to severe pulls that can even detach your muscle. This type of injury is more common in sports that require twisting, like tennis, football, baseball, and golf. Hernia. Another health issue in the abdominal muscles is a hernia. A hernia is when an internal organ pushes through a weak spot in your muscle. For example, your small intestines may push through a weakened abdominal muscle in your groin area, causing an inguinal hernia. Prune belly syndrome. Another condition that can affect the abdominal muscles is prune belly syndrome. This is a rare condition in which your newborn has absent or weak abdominal wall muscles at birth, making their belly, abdomen, look wrinkled. Other features of the disease include undescended testicles and urinary system problems. Common signs or symptoms of abdominal muscle conditions. Symptoms of abdominal muscle conditions depend on the type of injury or disease. Abdominal strains. Symptoms of a significant strain include difficulty moving, muscle spasms in your core, trunk pain while exercising, laughing, coughing or sneezing, swelling or bruising, trouble breathing in severe cases. Hernia. Symptoms of a hernia include aches or pain at the site of the hernia, bump or bulge that you can see and feel, more visible with straining, heaviness, ache at the site of the swelling, pain and or bulging when lifting something, prune belly syndrome, wrinkled or prune-like appearance of your infant's abdominal wall, large belly with loops of intestine that can be seen through the skin, undescended testicles, urinary system issues, including blocked or enlarged ureters, enlarged bladder and enlarged kidney. Common treatments for abdominal muscle conditions. Treatments for abdominal muscle conditions depend on the type of injury or disease. Abdominal strains. Treatment for an abdominal strain may involve local compresses, ice pack, heat, gentle stretches, as long as they don't hurt, nonsteroidal anti-inflammatory drugs, NSAIDs, oral or topical cream, physical therapy, rest, compression, binders. Check with your healthcare provider regarding their indication and length of use. Hernia. Treatment for a hernia typically includes surgical repair. Hernia repair surgery. Hernia repair surgery is a common procedure. A surgeon will push herniated tissue back into place. Then, they'll reinforce the barrier it pushed through with surgical mesh or stitches. Laparoscopic surgery. With laparoscopic surgery, a surgeon uses a long, thin tube with a lighted camera on the end, laparoscope, to look inside the surgical site. They place the laparoscope in one hole and surgical tools through another to perform the surgery. Prune belly syndrome. Treatment for prune belly syndrome may include antibiotics. Mild cases may only need antibiotics to prevent or treat urinary tract symptoms. Surgery. Most infants will need surgery to repair issues with their abdominal walls, genitals and bladders. Care. How can I keep my core safe and healthy? Several strategies can help you prevent ab injuries. Avoid sudden, jerky movements of your trunk. Be careful when lifting heavy objects. For example, lift with your legs or ask for help. Use good form when playing sports, lifting weights and participating in other exercises. Don't overdo physical activity. Eat nutritious foods like fruits and vegetables and drink plenty of water. This will encourage regular bowel movements and minimize constipation risk, which can help prevent a hernia. Maintain a healthy body weight for you. Talk to a healthcare provider about how you can strengthen your abdominal muscles. Rest when you feel discomfort or pain. Stretch every day, as well as before and after physical activity. Tighten your ab muscles when you cough or sneeze. Warm up before you perform physical activity, increase intensity gradually and then stretch well. At the end. Additional common questions. When should I call a healthcare provider about problems with my abdominal muscles? If you have symptoms of a significant abdominal strain, call your healthcare provider, especially if you have trouble breathing, moving, sitting, sleeping, walking. In addition, if you can see or feel a bulge in your abdomen or in your groin, you should be evaluated for a hernia. Your abdominal muscles are essential in keeping your abdominal organs safe and stabilizing your body during movement. Problems with the abdominal muscles are common. If you think you've strained an abdominal muscle, call your healthcare provider, especially if pain interferes with your everyday activities. If you can see or feel a bulge in your abdomen, groin, see your provider. Primary care providers offer lifelong medical care. From sinus infections and high blood pressure to preventive screening, we're here for you. Find a primary care provider. Schedule an appointment.